Just like they portray love in a very dramatized and over glorified way, they portray psychiatry too in a very dramatized and under glorified way.
Yeah.
Both of them are not true. I'm the best example for a person who has a midlife crisis right now. So along with being a psychiatrist, I'm also a certified mountaineer, a professional skier, as well as a trained martial artist. So whatever you're feeling today, let's suppose you're in the deepest of and the darkest of pits right now, there are always going to be days where you're able to come out of it, be better, do better. Nothing is permanent, including happiness, including sadness. No human is perfect, but AI is dangerously close to perfect. The presentation of depression in India, the subtext of Indian culture is very much different.
What is that thing which surprised you the most when it comes to mental health, when you started your journey?
The synergy of mental health along with physical health. We believe that a healthy body is a separate path, a healthy mind is a separate path. But I figured out that it's an amalgamation of both.
Great.
Like a sick mind will cause a sick body. A sick body will inevitably lead to a sick mind. Everyone is superficially aware of it, but the more you read the mechanism of it, the neurobiology of it, how BDNF works, how endorphins work, the whole neurochemistry of that, it's very beautiful. And that's what interested me the most, intrigued me the most.
What is that one life lesson you have learned from psychiatry that has helped you a lot personally and you wish everyone knew it?
The brain is a beautiful and a very pliable machine, I would say. So what we call as neuroplasticity reaffirms that the brain is very dynamic. So whatever you're feeling today, let's suppose you're in the deepest of and the darkest of pits right now, there are always going to be days where you're able to come out of it, be better, do better. Nothing is permanent, including happiness, including sadness, including just say mania, depression, all of this. The pliability of the brain intrigues me a lot, and it's a beautiful creation. So that's what I want people to know.
Sir, what do you think are the reasons for stigmatization of psychiatry for decades?
Very interesting. So right off the bat, what I feel is psychiatry has been kind of dramatized in a very negative way and portrayed in a very archaic way in our movies, especially, which historically is true as well. We had history of lobotomies, the electroconvulsive therapy which was given, the unmodified ones, was pretty barbaric.
Yeah.
Right? And there's also the pictures of asylum that we get to see, where people are chained, where they're just left to the elements of nature, or left in their own this thing, or the isolation wards. So all of this pop culture things which are partly true based on the historical realities are the ones which cloud our current perception of psychiatric care, which is very wrong in my experience, because we have a much more polished version of psychiatry care that is present nowadays. The second thing is the kind of cultural aspect to it. And I wouldn't blame the public entirely for this. As psychiatrist, I'm also aware of the shortcomings of our department, wherein lack of clear biomarkers or lack of clear tests. You can't do a scan to tell a depression, right? It is entirely based on the clinical judgment of the psychiatrist. So all of these factors do open up many questions regarding the authenticity of psychiatry as well, which I'm very much aware of. So these lead to a more shaky foundation, and which leads to stigma. So it is our duty to practice psychiatry in a more efficient way and also increase the awareness among the general population.
Yeah.
Just like they portray love in a very dramatized and over glorified way, they portray psychiatry too in a very dramatized and under glorified way.
Yeah.
Both of them are not true.
Very well said, sir. What is the biggest myth in mental health which you want to break it right now?
So the biggest myth, Yashwant, I think is that mental illness lasts forever or they are not treatable. I think working in psychiatry and seeing people recovering from the greatest malady, that is the mental health malady, right, is miraculous, and it's really inspiring. So the greatest myth that you need to cut right now is that mental illness doesn't have a treatment or a proper treatment. All analogy for the audience, think of it like a jigsaw puzzle, like solving a jigsaw puzzle. So medications are a part of that jigsaw puzzle. Without that piece, you can't solve the puzzle, but just that piece also won't solve the puzzle. So you need to have all of those things together.
Very, very well said, sir. Very well put. Yeah. Sir, a follow-up for that. Can people with schizophrenia or any major psychiatric disorder marry and lead a normal life with treatment?
Yes. In fact, this is an important part because this is for the lay audience. So this is something you need to be aware of. Not disclosing a previous psychiatric illness before marriage can lead to annulment of that marriage. You know?
Yeah.
So always have a consultation, do a genetic counseling or a premarital counseling. But yes, having a married life, having a normal married life is definitely possible if both the partners are aware and willing to put the efforts. And the second thing is, we find that marriage is actually a positive prognostic factor in schizophrenia.
Yeah.
You know? So having that family support is definitely good for the patient, provided both the partners are aware of it and are actively seeking treatment for the same. There is no contraindication for marriage or even children for that matter.
Yeah. And even in our OPDs, we see a lot of people who are schizophrenia, who have schizophrenia, who have bipolar disorder also, and are maintaining very well in their family. There may be some parts or episodes where they may have an aggravation of symptoms, but with treatment, they're working well. They're doing well.
Yes. So, final answer, be honest about it. No, don't hide it before marriage. That leads to loss of trust as well, which leads to complications. Point number 2, it is difficult. I'm not going to disagree with that, but manageable.
Yeah, great. Sir, why do you think borderline personality disorder is diagnosed more frequently in women? Is it biased or is it biological?
Very good question, Ashwant. In fact, personality disorders are my favorite Pandora's box in psychiatry. I just love personality disorders, because it's very much intrinsic. So this is a combination of both. It's like a double whammy. So let's talk about the biological factors which make a borderline personality disorder more frequent in females. So one that comes to my mind right off is the affective sensitivity. Women are more affective sensitivity, and the other thing is the childhood traumas. For example, sexual abuse, chronic neglect. All of these traumas are much more prevalent in women. So that is one of the reasons, is a contributing reasons for women being diagnosed with borderline personality disorder more frequently. And there's definitely a social bias to it. That's like the tadka on top. The emotional dysregulation or the coping mechanism can either be internally driven or externally driven, right? So internally driven would encompass like self-harm or emotional dysregulation, tantrums and all that. And externally driven emotional dysregulation would look more like, violence, substance abuse, reckless behavior, all of those things.
Internalizing or externalizing symptoms, as they say.
Yes. So women have a tendency to internalize these symptoms, which is more prevalent. So that is also the reason why they present more to our OPDs with these symptoms.
Okay.
Let's talk about the social biases. One thing is that women talk about their mental health more often. So they are more likely to end up in a psychiatric OPD setting and more likely to get diagnosed.
Okay.
Men, on the other hand, are not that emotionally aware of their own symptoms. They have some maladaptive coping mechanisms, especially men who have borderline personality disorder. So they end up in our OPD with symptoms of, let's say, antisocial behavior or substance use. So it gets metamorphosized into a different presentation, not primarily as a BPD.
Since you're interested in personality disorders, can people grow out of personality disorders, or do they just learn to manage them?
I think it's an amalgamation of both. So there is a component of people growing out of their disorder, as well as, for example, the impulsivity reduces, the kind of emotional reaction or dysregulation reduces with age, that is seen. But there's also a component wherein certain patterns of, let's say, the sense of vulnerability or the sense of, emotional dysregulation. Some patterns are definitely still present. The basic foundation of that personality disorder tends to stay, but the overt expression of it, the dysfunctional expression of it, definitely tends to reduce over age. It becomes more manageable.
Can severe trauma in childhood physically change the structure of an adult's brain, and can neuroplasticity reverse that?
Yes, this is very much seen in many studies that severe mental trauma, emotional trauma during childhood leads to a lot of neuronal pruning, what we call, some real, the CSTC loop as well. There are a lot of changes at the fundamental level that take place. And this is validated very much through studies. With proper therapy and medications, we can expect some reversal in this pattern, but it is difficult. It needs to be given more diligently. The treatment needs to be practiced more diligently, I think.
But that is possible. Because of neuroplasticity, that change is possible.
So that is what is neuroplasticity, and that's what is the most beautiful part of the brain. It is always dynamic.
So do we Indians experience depression symptoms differently than the standard sadness criteria?
Yeah. Yes. So culturally, all of this, whatever we practice, ICD-11, DSM, the clinical features or the criteria is very much based on this American studies or internationally based studies. So there's a lot of cultural connotations that we have. For example, depression is never straightforward in Indian subtext. It's usually along with some sort of a somatic disorder, and there's a lot of overlapping other mental illnesses that come. So yes, the presentation of depression in India, the subtext of Indian culture is very much different. I think the reason also for that is because mental health is very much stigmatized in the Indian population, whereas physical symptoms or problems related to physical health often takes or calls for more support from the family. That's the reason why it is reported in a much more common sense.
So mental illness leads to somatic or physical symptoms, but we are not recognizing the mental part.
Yeah, exactly.
But directly going to the worsened physical state.
True.
Yeah.
And a good psychiatrist will be able to delineate that with other symptoms.
What are the symptoms which are often seen in Indian patients who are actually depressed rather than just sadness?
I would say the somatic complaints, like body-related pain symptoms. That I think is the most common, I would say, substitute for a mental health issue as well.
Like a lower back pain, maybe
headaches, tightness of the upper neck, all of these things.
Okay.
The core symptom of depression is sadness, persistent, pervasive sadness. But oftentimes people are not very aware of that sadness. Just like intelligence quotient, we have an emotional quotient, EQ. So in people who have lesser EQ, they might not be able to address or express that in a good sense.